Good afternoon. My name is Bob Schlotman, and I'm the Chief Marketing Officer at Jackson Healthcare. Thanks to everyone for joining us on this webinar. This webinar is sponsored by the Hospital Charitable Services Awards. This is our 5th season of nominations. We have 50 programs who have received money from our awards, and we've given out over $400,000. The awards program is sponsored by Jackson Healthcare, a clinical staffing company. In addition, we'd like to make sure that in addition to the monetary benefits, they also would like to encourage peer-to-peer recognition for the community benefits and managers. In the interest of time, we'd like to ask everyone that if you have questions to use the GoToWebinar box down there and email questions to Alicia Kaufman. Right now, it's my pleasure to introduce Thornton Kirby. Thornton is President and CEO of South Carolina Hospital Association. Thornton chairs the boards of both South Carolina Office of Rural Health and Well Vista, an organization committed to improving health and wellness for the uninsured. Recently, he was appointed to the Joint Commission Board of Commission Resources, a nonprofit affiliate of the Joint Commission, an independent non-for-profit organization that accredits and certifies more than 17,000 healthcare organizations and programs in the United States. Thornton is a graduate of the University of Virginia and the USC School of Law. Before joining the South Carolina Hospital Association, Thornton practiced law as a hospital attorney. He was vice president of Toomey Regional Medical Center in Sumter, South Carolina, and spent 8 years as the senior administrator of Clemson University. Welcome, Thornton.
Thank you, Bob. It's really a pleasure to be with you guys and also to join this really exciting conversation about how you take community benefits programs and get the C-suite engaged in them. And I want to talk about that a little bit today with some concepts that I presented at the conference that we had, the awards presentation conference a couple of months ago, with a few twists in it. First thing I would say is this is not so much about community benefits as it is about issue management. How do you ensure that your issue is getting senior level attention? And in this case, we want it to be about community benefits, but the things I want to talk about really apply to any issue that needs to come to the senior level group. So if we go to the next slide and we make sure there we go. We go to the next slide. These are the challenges that your peers said they faced when we polled them or surveyed them earlier in the year. How do you get funding? How do you do your communications? How do you ensure relevance of the program and recognition and awareness of the programs? You see those things. They may resonate with you. They are probably representative of what people would say about any issue where they need to get senior level attention. So where do we go from there? I want to start by talking about the challenges associated with popularizing an idea. Trying to advance this slide. Alicia, can you help me? There we go. Okay. The concept here we have is that if you want to take an idea and popularize it, which means get the organization really behind it, there has to be work done associated with that. You have to build mass and momentum with your idea. And you can't really do that unless you are overcoming the inertia of the organization. And all organizations have inertia, particularly large organizations like hospitals. They are moving on a certain trajectory, and if you want to change that trajectory, you really have to have a game plan for doing it, and that's what I want to talk about. There are certain tricks to this game plan that I have found to be very effective, and we'll go through them quickly one at a time. The first one is framing the issue. How do you frame an issue properly so it gets attention? Number 2, working that issue or that idea. Number 3, understanding and learning the rules of the organization. Number 4, recruiting thought leaders from the organization. And number 5, making the case. How do you make your case? And I want to we're going to talk about that a little bit in a few minutes. Framing the issue. This is a really important part of any kind of issue management. I don't know if you remember some years back when Bill Clinton was president, or he was running for president against the senior George Bush. And when we talk about framing an issue, it's important to look back and remember, President Bush was a very popular president at the time because of the Gulf War, and the only way Bill Clinton was going to get elected was by not attacking him for his foreign affairs, but to get back on the domestic agenda. And he came out, reframed the whole conversation of the election and the campaign around the economy. It's the economy, stupid. If you recall that was Bill Clinton reframing an issue so that it favored him and it got people talking about what he wanted to talk about. That's a very valuable thing to do, is frame the issue correctly. And I'll give you one example, a quick one. In South Carolina, we're talking a lot about Medicaid expansion, and when we talk about Medicaid expansion, some people argue on the far right, this is a states' rights issue. We don't want the federal government forcing its will on the people of South Carolina. We can't afford this, etc. We have tried as a hospital community to reframe that and say, hey, this is passed by all the states working together in Congress, and the other 49 states are offering to pay 90% of the cost of covering our uninsured people, and we ought to let them do so. Otherwise, our business community has to do so. So that's an example of trying to reframe a conversation. To date, we have not won this, the Medicaid expansion conversation, but we have caused people to discuss it in different terms, which is the challenge of reframing. So that's just an example of how you reframe a conversation. The next one is working an idea. How do you work your idea? That means getting people to that you trust and you know to help you refine your thoughts. What do you want to do with the idea itself? What do you want to do with your community benefits program? Is it strong enough? Is it sharp enough yet? Is it ready for prime time conversations? I like to get people who are really smart from different perspectives, who do different things, a financial person, a public relations person, people who don't think like I do. I was trained as a lawyer. And to get them in the room and discuss an issue so I can see a lot of different sides of it. That's what I mean when I talk about working the issue, working the idea. You really can't spend too much time refining it. Once you have it refined, now you're ready for prime time, and it's time to learn the rules of the organization if you don't already know them. So first of all is the process. In most hospitals, large organizations, there is a massive organizational chart. And you can see this as an example. There's so many people reporting to so many other people. It's very important to know who the decision maker is on any given issue. And it's hard to find out sometimes, but it's important to find out. It's not always who it might seem to be. You need to figure out who the decision makers are. The next thing after the process is the rules of the game. Now this is where, as a corporate lawyer, I see a lot of different things coming together. There are always two sets of rules in any organization. The first set is the formal rules, those things that are legally required. In other words, law of the state says in a corporate setting the board has to make certain determinations, and the board can delegate certain things to the president or to CFO or whomever. Those are formal rules. There also are informal rules, and that's cultural issues. Let's go back one slide, if you will, Alicia. When we talk about formal rules, what do the articles of incorporation say? What are any laws that apply to this? In hospitals, we always have to worry about laws and regulations, HIPAA, many other things like that. And then has authority been delegated? You have to learn those things to figure out who your decision makers are. The reason I have those on my list is it's very important to know who's going to make the decision on your issue. Now, next slide, Alicia. There are also informal rules that are very important, and that is the culture of the organization will dictate things as well, and that's what I call the informal rules. You probably know the saying that we've all heard many times, culture eats strategy for breakfast. In other words, you can have a plan, but if your organizational culture, in our case, if the medical staff, for example, in a hospital doesn't want to do something, it really doesn't matter. If they're not going to work with us, we have a problem. The other thing about informal rules that's very important to note is that the people who have authority for certain things are not necessarily the same ones who have influence over everything. And you need to figure out who are the influencers and then who are the decision makers. That's an important distinction. Now, the next issue kind of plays onto that, and it has to do with recruiting thought leaders. And I've found this to be the most valuable strategy of all. Now, thought leaders make me think of Thomas Jefferson. When I went to the University of Virginia, you know, Thomas Jefferson said, we hold these truths to be self-evident, that all men are created equal. Well, actually, they're not. Not when it comes to organizational decision-making. Some people are much more important in the decision tree of an organization than others. And it's because they have, they've been very successful over time, or they have earned extraordinary influence. Here's an example of a thought leader for our society, our culture. That's Steve Jobs, the late Steve Jobs. He changed how we think about communication and how we think about accessing internet and talking to each other through our smartphones. Serious thought leadership there. These people have disproportionate levels of respect, and you need to find them in your organization. Who are they? If you want your C-suite, now let me make this relevant to our conversation. If you want your CEO to support your community benefits program, you need to figure out who influences the CEO's priorities. Is it the CFO? Is it the lawyer? Is it somebody else entirely? Who drives their thinking? And you need to find that person, and you need to get them on board with community benefits, because once they're sold, they'll be whispering in the ear of the decision maker that they should go forward with your program. And that's how I've seen this successful in many, many instances across a lot of different kinds of organizations. These thought leaders are critical to your success. You want them to endorse your community benefits program. It may be a particularly influential board member. It may be the chief operating officer. It may be a physician in the organization that really carries a lot of weight. But you want to have them endorse the idea, because that makes it more valuable. Now, the other thing you want to do is never assume that they're going to be endorsers. Just because you think they like your idea does not mean that they're going to endorse it when the time comes. You need to be sure you've talked to them about it before game day, as I said, before the actual decision gets made. And I find the best way to get them on board is to let them have some influence over how the idea develops. So if you have a community benefit strategy now, or a community benefit program, why don't you talk to some of these thought leaders, a particular physician or a board member, see what they like about it and see what they would like to see better or different. And if you massage it a little bit to reflect their input, now they get really bought into it, and they will go to bat for you with decision makers. That is a very effective strategy. I've used it, and I've seen a lot of other people use it over a long period of time. Next bullet is making your case. And I would say the most important thing you can do is be sure to use data. Most smart people will make good decisions if they have good information in front of them. So if it's your community benefit program is, if you want to make your case around saving money, then use good data, reliable data about how it saves money. An investment up front avoids this kind of expensive care, and therefore we should do this. Or if you want to say, there are many of the community benefit programs we've seen that seek to change behaviors in the community, like early teen pregnancies or obesity or fitness. How do you want to measure that? How do you make the case that it's a good thing to do? Well, figure out your data, try it out on some thought leaders, and see how they react to it. If they find it compelling, then you know you've picked the right things. If they ask you questions that you can't answer, maybe you need to go back and add some other data. But using data to make your case is a very important feature. Now, the last thing I want to talk about is working with CEOs. When you do get your audience with your CEO, you probably know this, but you got to get to the point with them. They don't have a lot of time. because they got to go from one thing to the next all day long. Make sure you get to the point and keep your eye on the big picture. Try to figure out what their priorities are. What is the CEO thinking about, and why is your program relevant to it? Now, we obviously know that community benefit is an important part of the ACA. We need to tailor our programs so that they are responsive to community needs assessments. That is an obvious reason to talk about your community benefit program. But there are others that vary from community to community. Sometimes the local government really wants to see some community benefit of a certain type, or sometimes certain parts of the community want to see the hospital engaged in something. Make that case, keep their eye on the big picture, and take time to understand what they are working on and concerned about every day. And then, as I said, thought leaders are important. Those CEOs have thought leaders. Who is it that influences their decision making? If you watch them long enough in meetings, you'll realize eventually who they turn to, who they put a lot of weight in or a lot of stock in when they make their decisions. You want to figure out who they are. And then the final thing is avoid surprises. When you deal with a CEO, don't let them be surprised that something happens in the community or the community benefit program has a glitch in it. Don't let them be surprised. Always give them time to prepare their thoughts and react in advance. So those are a few tips. Going back to the whole overarching outline, frame your issue. Make sure you talk about what you want to talk about. Don't respond to somebody else's framing. Make sure you give your community benefit program the best framing that you can. Then work it. Make sure that no matter how long you've had it in place, ask around, how could this program be better? How could it be more efficient? How could it be less costly and more geared to the outcomes we want? Learn the rules of how the organization makes decisions, and then learn the cultural issues. Recruit your thought leaders, and then make your case to the decision makers. I think that's a great way to approach this challenge. You know, as a final slide, I would tell you, it's not enough for you to have a great idea. A lot of people have great ideas. You've got to have a plan and a supporting cast to make it come into a reality. And many of you already have community benefits programs. What you want is to have them attract more resources and more organizational support. I think this framework works very well for that. So, Bob, with that, you asked me to do 15 minutes. That's right about 15 minutes. Let me turn it back to you and see how you want to go from here.
Thank you very much, Thornton. I appreciate your very insightful comments. I think right now, I want to remind you, I think in your GoToMeeting box, if you have any questions, you can type in your questions, and we will get back to you with the answers. And again, I just wanted, in summary, we want to remind you that the Charitable Service Awards host content like this free of charge during our nomination process. We also post stories on our website that are relevant to your jobs and highlight leading best practices in community benefit. If you're interested in nominating your community benefit health programs for the awards, the deadline is August 22nd. Actually, we have I guess the next slide is that why nominate? Again, just to reiterate, we have obviously $10,000 for each program of excellence. We have $2,500 for a program of promise. These are programs that are very innovative, but don't really have a whole lot of data yet because they're brand new to talk about impact. It's also an opportunity for each of you to share your programs with others as far as best practices are concerned. And it's an opportunity to receive not just local recognition, but also national recognition for your programs. If you would like to request a nomination, the website is Hospital Charitable Services Award.org. And the program manager is Alicia Kaufman, and her contact information is on the slide. Again, I think on behalf of Thornton and myself and all the folks at the Hospital Charitable Services Award, we really appreciate your attendance and look forward to receiving many nominations. Thank you very much.